Hi there. Okay, so we're going to do some EFT to help with getting to sleep at night. And for anyone who isn't experienced with emotional freedom technique, what we're going to be doing is tapping on parts of the head and torso and hands and saying words. So it's a combination of somatic therapy, body work, and like a form of cognitive behavioral therapy. So we're introducing these, moving from, the negative aspect of what's going on and what we're feeling and thinking, and through to a little bit more neutral, and then on to the positive. So we'll be ending on the positive note. Now with EFT for sleep, we're not trying to get to any deep rooted issues behind why we're maybe not getting to sleep. We just want to calm the whole nervous system down, and our overthinking monkey mind, and our body that might be physically reacting when we go to lie down and try and go to sleep. And we want to calm all that down. So if you're doing some EFT for getting to a root cause of what's going on, you might do it earlier in the day so that your system isn't still whirring when you're going to bed. Okay, so all you need to do first is follow along where I'm tapping and the words that I'm saying. And you might find that you are yawning, even if it's not to do with sleep for the tapping that we're doing or the EFT. Yawning is a release, it's a body release. So you might find that you have tears, you might yawn, you could burp. It's all this shifting, moving energy within the body. All normal and all good signs that it's having an impact on you. So I suppose, unrelated to the EFT section of it, if you're having difficulties with sleep, there's certain sleep hygiene things that you can do to try and help your body get to sleep a bit easier. So things like not drinking too much caffeine. I would tend to not drink caffeine after about 2 o'clock in the day because I find I'm quite sensitive to it. And if I have a coffee in the evenings, there's not a hope of me getting to sleep. So I'm conscious of that now, I'm aware of it, and I know that I can have my coffee in the morning, but not later than lunchtime. Things like going to sleep at the same time each night. Now I know that's not always possible, but where possible to try and keep it within a reasonable window, because your body gets used to the rhythms and the habits that you form then, and it gets used to going, okay, we've had our dinner, we've done whatever we do in the evenings, and now it's time to go to sleep. Getting up at the same time each day as well is another one. So if you are somebody who lies in, or that at the weekends, you might find that once you get to Monday again, it's hard to get back into that cycle of sleep. So there's lots of different things. You might find that, watching a high action movie right before you go to bed maybe has your system a bit wired. Our imagination and in our mind, it can't tell the difference between real or imaginary. So if you're watching these really kind of violent, high speed chase fight scenes, all this sort of stuff, you might find that actually going to bed after something like that, you find it more hard to settle. Or things like watching a lot of the news. There's so much going on in the world at the moment. And if you're watching a lot of news, you might find that your head's whirring with it all. You can't switch off, you can't kind of let it go. So it's just being conscious of what your triggers are for you not being able to settle, and trying to minimize the external things that you have control over. All right, so we're going to go through a few different kind of rounds of the tapping, looking at different areas of sleep. So we're going to go through the emotions that you might feel when you're going to bed, if you're somebody who's been having trouble sleeping, thoughts and beliefs that come around getting to sleep, body sensations, whether that's palpitations or tightness in your neck or chest, or something that comes on you when you go to sleep. Things that we do, actions that we do or don't do. So, just watching one more episode on Netflix of the series that we're watching, and I'll go to bed after this, and then it's just one more episode. Or imagery that comes into our minds around sleep. If you are listening to my words and they're not quite landing for you, change them to words that are more appropriate. So the closer you can be to how you're feeling in the moment when you're going to sleep, and tapping and releasing that, the more effective this is going to be for you. So this is a generalized sleep one. If you find that your body sensations are tightness in the chest, or maybe you could feel a sickness in your tummy, so you just change the wording to whatever works for you. Okay. what we're going to do as well is just rate it out of 10, you know, tune into your body and rate out of 10 how bad you feel when you go to sleep. You know, is it that you feel awful and sick and it's the worst feeling ever, or is it just a niggly kind of sensation? This will help you to assess how well the EFT is working for you, whether it's been really effective or not so effective, or whether it's brought it down in intensity a little bit. But you need to do another couple of rounds just to completely bring down that stress response in you. So have a little tune into how you're feeling in your body. Now this tapping session you can play and replay, you know, before you go into bed, just to help you kind of unwind and get to sleep. Especially if you're somebody who's suffered from problems with sleeping, you know, even the thoughts of going to bed sometimes, and that sets us off. Okay, so tune into your body, have a little feel into where you're feeling it in your body when you think about going to bed. Rate it on a scale of 1 to 10, 1 being it doesn't bother you at all, and 10 being it's the worst feeling ever. Okay, and we're going to start on the side of the hand here. Okay, so you're just tapping with a few fingers on the side of the hand. You're not tapping really hard. And if you're somebody who feels naturally a little bit anxious, try not to go too fast, because that really fast motion can kind of make you feel more anxious. All right, so just tapping gently on the side of the hand, and repeat after me. Even though I'm feeling anxious about going to bed tonight, right here, right now, I'm okay. And even though I have all this fear in my body when I think about trying to go to sleep tonight, right here, right now, I'm safe. Even though this anxiety is showing up just thinking about going to bed, it's okay. I'm going to do the best that I can. Okay, so now we're going to the top of the head. So just using, you know, 2 or 3 fingers on the top, all around the top of the head there, okay? This anxiety that I'm feeling. Okay, now eyebrow point is just up here, so just where the eyebrow starts, okay? It is important to tap on the correct points, okay? But you have, it's not like acupuncture and you have a tiny little needle, like you're using 2 or 3 fingers, so you will hit the spot if you head for the right area. This anxiety in my chest and my body. Okay, side of the eye. This fear around getting to sleep this evening. Under the eye. And you're just on the bone, on the orbit, so not right in underneath, just under here. So much fear in my body. Okay, under the nose. All this fear and anxiety shows up. On the chin. All this dread. Now the collarbone point, so your collarbone is the bone that runs along here, okay? And just underneath that there's a little kind of fleshy soft bit, and that's where we're going on both sides. All this dread. Okay, under the arm. Just thinking about heading to bed. Wrist, so along the crease where your wrist creases. Knowing that I most likely won't get to sleep. Squeezing either side of the fleshy part of the thumb there. All this dread. Keep going along the different fingers. All this anxiety in my chest. Next finger. All of this panic. Next finger. All this anxiety in my chest. Next finger. Worrying about getting to sleep. Okay, we're going to do a round on body sensations, okay? So, side of the hand again. Even though I have all this tension in my neck and shoulders, just thinking about going to bed, knowing that I'm not going to get to sleep, right here, right now, I'm okay. Even though I can feel it in the pit of my stomach, knowing that I'm not going to be able to sleep tonight, right here, right now, I'm safe. And even though I can feel the palpitations coming on at the thoughts of lying awake in bed again tonight, because I'm not able to get to sleep, and that's okay. Okay. Top of the head. All of this tension in my body. Eyebrow. This tension in my neck and shoulders. Side of the eye. Feeling palpitations in my chest. Under the eye. All this tightness in my chest. Under the nose. All this muscle tension. Chin. Just the possibility that I won't be able to get to sleep. Collarbone. I can't seem to will myself into relaxing. Under the arm. The more I focus, the worse it gets. The wrist. All of this tension in my body. Thumb. I can feel my heart beat in my ears. All of this stress. All of this build-up of tension. These palpitations in my chest. I feel like I can't catch my breath. Okay, take a deep breath in. Okay, so now we're going to go into what your mind is actually saying to you. So you go to lie down and all the thoughts that come into your head and just won't switch off. Okay, side of the hand. Even though my mind doesn't believe it would be able to sleep tonight, it says, why do you even bother? You're never going to be able to get to sleep. Right here, right now, I'm safe. Even though I'm just thinking about going to bed, my mind is telling me, no way I'm going to let you get to sleep tonight. I'm thinking about my to-do list, everything I've got to do for tomorrow. It's not possible for my body to fall asleep. Right here, right now, I'm safe. Even though my mind always runs the reels of the highlights of my most embarrassing moments, right as I'm trying to go to sleep, I wonder if it's possible to put all my worries down on paper first so that I can let my mind rest. Okay, top of the head. It might not be possible for me to sleep tonight. Eyebrow. My mind might not let me sleep. Side of the eye. It might not be possible for me to get to sleep tonight. Under the eye. But I wonder if it's possible. Under the nose. For my mind to know that it's safe for me to go to sleep tonight. Collarbone. It's safe in my bed. Under the arm. I can pick it up where I left tomorrow. Wrist. The place isn't going to fall apart if I forget to do one thing. I put all of this pressure on myself to get everything done. It's not the end of the world if I drop a ball. It's safe for me to go to sleep tonight. I can ask for help. I don't need to be thinking about all of this right now. Okay, so we're going to move on to images that come up when you're trying to go to sleep. Some people are more visual than others, so this might resonate more than the feeling for you. Okay, side of the hand. Even though I have this image that pops into my head when I can't get to sleep, right here, right now, I'm safe. And even though I have this image of me lying here, unable to sleep, right here, right now, I'm okay. Even though I have this image pop into my head of me unable to sleep, and it's not letting me wind down and rest, right here, right now, I'm safe. Okay, top of the head. It's okay for me to relax. Eyebrow. This image of me wide awake is stuck in my head, side of the eye. It's getting me all worked up, under the eye. I'm so fed up with this constant drama and getting to sleep, under the nose. Why can't I just switch off? Chin. I don't want these images in my mind. Collarbone. Maybe I can let my mind settle. Underarm. Maybe I don't need to have this constant movie or pictures flooding into my brain. Wrist. What if I could unwind with ease at night? That's an image I would be happy having in my mind. It's okay to unwind. It's okay for me to go to sleep. It's safe for me to go to sleep. Okay, and the last little round we're going to do is on things that you're doing or not doing that are preventing you from going to bed or getting to sleep. Okay, side of the hand. Even though I just want to stay awake and watch TV because I know I'm not going to be able to get to sleep straight away anyway, that's okay. Right here, right now, I'm safe. And even though all I want to do is stay up and watch rubbish TV, because I know it's going to distract me from my lack of sleep, right here, right now, I'm safe. Top bed. I want to avoid bed. Eyebrow. I want to watch just one more episode. Side of the eye. Because I know I'm not going to get to sleep anyway. Onto the eye. So I want to stay up and watch TV. Onto the nose. Or maybe I'm staying up and chatting or reading my book. Chin. But it is okay for me to go to sleep. Collarbone. It's safe for me to go to sleep. Maybe my nervous system can allow me to relax and get to sleep without all the tossing and turning. Wrist. Maybe there's a way that I can relax and get to sleep without all of this build-up of stress. I'm choosing to let go of all the anxiety in my body now. Finger. Choosing to let go of any dread that I've been feeling around getting to sleep. I'm relaxing all the muscle tension that's built up over the day. I'm choosing to relax my muscles that have tensed up with the thoughts of trying to get to sleep. I'm choosing to move now and turn off the TV. My day tomorrow will be so much better and brighter when I have a good night's sleep. My delay in going to bed isn't going to help me. I deserve a good night's sleep. I have permission to sleep well. I'm worthy of getting a good night's sleep and having a rested body and mind in the morning. It's possible for me to get a good night's sleep. I allow my mind to switch off. It's safe to unwind. It's safe to sleep. It'll all seem better in the morning when I'm rested. I deserve to get a good night's sleep. I'm worthy of rest. I am safe. I am safe. Okay, take a deep breath in. Throw it all out. Okay, and do a check-in with yourself. Have a feel into how you're feeling. Are you more relaxed? Is the stress still there? Do you need to go through another round of it? Which is possible, it might necessarily all dissolve in one round. And yeah, see how you go.